Millions of Americans suffer daily from the life-altering symptoms of a condition called peripheral neuropathy. Tingling, numbness, or burning pain in your hands or your feet, electric shock-like pains, difficulty walking or balancing, or even strange sensations like feeling a sock is balled up under your foot. These are all signs of neuropathy. Hi, I'm Dr. Mark Shelley, a chiropractic physician, board-certified functional neurologist, and clinic director at Sound Pain Solutions. Sound Pain Solutions is a network of clinics located throughout the Puget Sound region that uses advanced rehabilitation procedures to treat chronic nerve and joint pain without the use of narcotics or surgery. In a moment, you'll also meet some more of our care providers. Thanks for taking time to view our neuropathy video series. Over the years, we've literally had thousands of patients describe their symptoms to us. All of these symptoms have one thing in common. They rob neuropathy sufferers of their quality of life. What makes it worse is that most have been told there's no way to find relief outside of taking drugs that just mask the pain. I want you to know that's not always the case, and masking the pain with prescription drugs does not prevent the progression of nerve degeneration. For many neuropathy sufferers, there's an alternative. At Sound Pain Solutions, we use a combination of therapies that actually rehabilitate damaged nerves and get our patients back to an active and fulfilling lifestyle. We use treatments like bioelectrical therapy, non-invasive laser, and balance therapies customized for each patient. All of our treatments are non-surgical, FDA cleared, and narcotic-free. Best of all, for patients that qualify, they're highly effective. In this video series, we want to give you an overview of neuropathy, including the symptoms and causes of peripheral neuropathy, common medical treatments for this complicated medical condition, and of course, we'll go in depth into the comprehensive treatments we use at Sound Pain Solutions to rehabilitate our patients' damaged nerves and help them regain their quality of life. If you or someone you know is suffering from neuropathy, I hope you find this video series helpful to better understand the condition and your treatment options. Thanks for watching. Neuropathy simply means that the nerves are not working properly. The National Institute of Health estimates 20 million people in the United States have some form of peripheral neuropathy. More than 100 types have been identified, each with its own symptoms and prognosis. But there are some telltale signs that nerve damage has occurred. The symptoms can generally be grouped into two basic classifications: negative and positive symptoms. Some people describe what are classified as negative symptoms. This includes sensations like decreased sensitivity, numbness, tingling, or feeling like the hands or feet are dead or asleep. If the condition is allowed to progress, reduced sensation can become dangerous as balance becomes impaired and risk for trips and falls increases. Other patients experience what, strangely enough, is categorized as positive symptoms. Positive symptoms include sensations like aching pain, burning, electric sensations, pressure or squeezing, throbbing, freezing, stabbing, or feeling like their socks were balled up underneath their toes. As neuropathy progresses, symptoms often become more severe and have a growing impact on a patient's quality of life and often their family. Standing and walking can become difficult and limited. Ultimately, independent mobility can be threatened. Some neuropathy sufferers are forced to rely on walking aids, progressing from a cane to a walker, then ending up in a wheelchair. It's important to begin treating neuropathy as early as possible to prevent it from progressing to the point where rehabilitation is no longer possible. Thankfully, due to the advances in neuroscience and technological breakthroughs, now many neuropathy sufferers can slow or stop the progression of the condition. With treatment, many patients experience relief of pain, restoration of balance, strength, and mobility. We're able to help many neuropathy patients regain their lost quality of life. The advanced, comprehensive treatment procedures we use are narcotic-free, non-surgical, and best of all, for many neuropathy sufferers, they're highly effective. The most common causes of distal symmetric polyneuropathy in Western countries is type 2 diabetes. Many patients come to us suffering from what is classified as diabetic nerve pain. Other known causes can range from vitamin or mineral deficiency to chemotherapy drugs, among many others. Many cases of neuropathy, however, are considered idiopathic, meaning the cause is unknown. This can be extremely frustrating for patients and doctors alike. Most neuropathy sufferers come to us because they haven't been helped with standard medical treatment. Many have been told there's nothing that can be done to treat their condition. They just have to live with it. Some were given prescriptions for medications that produce side effects that are worse than the neuropathy. Medications frequently prescribed for neuropathy include anti-seizure prescriptions like gabapentin, anticonvulsants such as Lyrica and pregabalin, serotonin reuptake inhibitors including Cymbalta and duloxetine, and lastly, opioids like tramadol and oxycodone. These medications come with a laundry list of symptoms that can accompany their use. At this time, there's no drug that can restore lost sensation or improved impaired balance caused by peripheral neuropathy. Taking medication is not going to rehabilitate the nerves. As numbness and tingling progresses, position sense and stability often deteriorate. Inevitably, the consequence is an increased risk of falls. It's no wonder neuropathy is so frustrating for patients and physicians. It's the same reason patients who qualify for our treatments are so thankful that they found us, because our treatments are effective for so many neuropathy sufferers.
Fortunately, advances in neuroscience and breakthroughs in medical technology have provided us with narcotics-free, non-surgical, safe and effective treatments that have helped thousands of neuropathy sufferers. The process we use to determine if a patient is a candidate for our care is simple. The first step is to schedule a consultation free of charge. During the consultation, our doctors will screen for the signs of medical conditions that would rule out treatment. If medical management is necessary, we want to quickly get you to the correct provider. Then, a series of tests will be conducted to determine the extent of nerve damage to determine if you are a candidate for treatment. Even with our comprehensive treatment approach, if the neuropathy has progressed too far, conservative treatment may no longer be an option. Next, the test results are assessed to determine how much improvement is likely. Each patient's condition is unique, as is their treatment. The underlying cause, extent of nerve damage, and overall health of the patient all contribute to how well and how quickly someone will respond to treatment. Providing realistic expectations for all of our patients is a top priority. Patients are then presented with a treatment plan that outlines the type of rehabilitation methods that are recommended for them. The comprehensive treatments used in our clinics typically take between 45 and 90 minutes. Generally, clinic sessions start at 2 to 3 days per week and then reduce to 1 day a week. Patients are also given instructions on how to support their in-office treatment at home. It is optimal for patients to perform their home care procedures 2 times per day. Each session typically takes between 15 and 20 minutes to complete. The primary treatment procedures we use are FDA cleared. Still, for years, our patients had to pay out of pocket for all of their treatments because insurance companies refused to cover the innovative treatments. Now, most patients that are candidates for our new bioelectric treatment enjoy the benefit of having insurance cover a significant portion of the treatment expense. This has opened up the door for many neuropathy sufferers so they can have access to the care they need. We will work closely with you to develop a care plan that will help reduce your symptoms, produce optimal nerve repair, and take into consideration the out-of-pocket expenses. Your free consultation will give us the information to determine if you are a candidate for the treatment, what types of treatment, and how much treatment you will need. This allows us to give you an estimate of your treatment costs before you incur any expense. We do our best to answer all your questions up front. Not all of our therapies are appropriate or necessary for every patient. Peripheral neuropathy rehabilitation plans are customized to each patient's treatment needs. Treatment plans may include bioelectric therapy, infrared and high-dose laser, vibration therapy, balance therapy, nutritional supplementation, spinal decompression, manual therapies, and lifestyle recommendations like sleep, diet, exercise, and stress management. Each therapy serves a specific purpose and complements the treatment to rehabilitate your damaged nerves. Unlike other treatments you may have heard of, the goal of our treatment is not just masking your pain or giving you temporary relief. Fuel and activation is the mantra of functional neurology. Each of our comprehensive treatments are designed to feed the nerves and exercise them.
As a leader in conservative treatments for chronic pain conditions, Sound Pain Solutions continually searches for new innovative pain and rehabilitative treatment procedures. In 2021, we added a new bioelectrical therapy to our comprehensive treatment repertoire that gets remarkable results. In addition to providing greater pain relief, studies demonstrate that this new therapy can actually regenerate damaged nerves. Our bioelectrical therapy is an advanced electronic cell signaling device that restores the function of nerves by pulsing electrical signals through the area of impaired function. Additionally, for some patients, injections of anesthetics like lidocaine or supplements can enhance treatment response. Microprocessors continually vary the wave frequency, amplitude, and polarity and pulse the signal up to 20,000 times per second. The result is increased cellular repair, reduction of pain and inflammation, and restoration of function. Studies show 85% of neuropathy sufferers report a 50% reduction in pain, and 73% demonstrate new nerve fiber growth on punch biopsy.
Infrared light therapy directly increases circulation to the nerves and other local tissues. This reduces inflammation, increases the delivery of nutrients and glucose and oxygen. Studies have also shown that infrared light therapy can be beneficial in the healing of damaged arteries and nerves. Infrared therapy is typically applied using a boot to cover the foot and pads to cover the back of the leg. Hands and arms can be treated in a similar fashion. Clinical studies and research using laser therapy have demonstrated reduced pain and inflammation, as well as stimulated nerve regeneration, muscle relaxation, and improved immune response. Our body can benefit from absorbing certain frequencies of wavelengths of light, similar to the way plants benefit from sunlight and use it to grow. Our bodies absorb near-infrared light and convert it into ATP. When we are exposed to laser light at an appropriate wavelength and frequency, we produce ATP. ATP is the energy currency of the cell. So, higher levels lead to an increase in cellular health and increased rate of repair. High-dose laser therapy is a powerful weapon in our arsenal to combat neuropathy and rehabilitate the nerve endings. Vibration therapies are used in our treatment of neuropathy. Whole body vibration therapy has been used for the treatment of pain, for rehabilitation, and to enhance athletic performance. Studies have demonstrated the benefits, such as increased muscle strength and endurance. Because the muscle fibers are activated up to 20 to 50 times per second, this allows muscle fibers to be exercised rigorously in a short period of time. Vibration has also been linked to increased blood and lymph circulation. The rapid contraction of the muscles producing a pumping action that increases circulation, enhancing the removal of cellular waste, and it also improves the delivery of the nutrients. Our neuropathy treatment program works by creating an environment that supplies adequate oxygen and maintains a healthy, stable level of glucose. Specific supplements can be beneficial for the nerve repair in certain conditions. We use a combination of supplements in conjunction with our therapies to accelerate the healing of damaged nerves and blood vessels, promote the activation of nerves, and reduce inflammation from oxidation. For neuropathy sufferers, lifestyle factors can play a very important role in recovery. This is why our doctors may address sleep, diet, exercise, and stress management considerations. The single greatest source of activation for our nervous system comes from the receptors in our muscles called muscle spindles. Every time a muscle is stretched, the muscle spindle fires a signal activating the nerves. This activation is essential for nerve health and longevity. Physical exercise has been shown to improve balance of patients suffering from peripheral neuropathy. The appropriate activity and exercise recommendations can greatly impact the degree of success a neuropathy patient experiences. As we just reviewed, every time a muscle is stretched, the nerve is activated. If joint motion is restricted, muscle spindle activity is reduced. This reduces exercise for the nerves. Joint mobilization and adjustments can restore lost mobility, improve muscle function, and increase the activation of the nerves.
Some patients come to us with both distal symmetric polyneuropathy and nerve compression. Clues to this combination of conditions are symptoms that start on one side only or are noticeably more severe on one side than the other. More obvious clues are having back or neck pain that accompanies symptoms of neuropathy in the hands or feet. Patients with nerve compression require spinal decompression in addition to peripheral neuropathy treatment. When conservative measures have failed, the standard medical treatment for spinal nerve compression is decompressive surgery. Most medical experts agree that back surgery should be a last resort. Instead of surgically removing disc material causing pressure on the nerves, non-surgical decompression uses a sophisticated machine that gently stretches the spine, creating negative pressure inside the disc. This draws bulging disc material back into place. Non-surgical spinal decompression is another invaluable treatment available in our narcotic-free and non-surgical treatment approach. Unsteadiness when walking, feeling dizzy, tripping, and falling are signs of balance problems. According to the CDC, roughly more than 1/3 of adults aged 65 years old and older fall each year. Preserving independence in activities of daily living and mobility is a chief concern for our neuropathy patients. Balance therapies tailored to each patient are a key component in our comprehensive treatment plan for every peripheral neuropathy patient. Many of our neuropathy patients say that the greatest benefit they receive from treatment is regained confidence in their ability to walk and the ability to return to a vibrant and active lifestyle. In addition to the in-office treatments for peripheral neuropathy, each patient is trained how to perform home therapies. These home treatments become the foundation for maintenance therapy. Patients are assigned simple at-home exercises like thermal contrast exercise, mechanical nerve stimulation, stretches and exercises, sensory motor coordination, and balance exercises. Thank you for taking time to learn about peripheral neuropathy, the symptoms, and most importantly, your treatment options. If you only take one thing away from this video, I want you to remember that prescription medications will not stop the progression of your neuropathy. They only mask the symptoms. Medications can't prevent the progression of your condition or improve balance. Next to helping you get relief for your symptoms, slowing or stopping the progression of your condition is key. We want to provide you with treatment and training so your lifestyle and activity options won't be severely limited. We can help most neuropathy sufferers if they start treatment before it has progressed too far. At Sound Pain Solutions, we use a comprehensive combination of state-of-the-art treatments to rehabilitate damaged nerves to get you back to activities and the lifestyle you desire. If you suffer from any of the signs of neuropathy, tingling, numbness, stabbing, shooting, or burning pain in your feet or your hands, or maybe you're already experiencing limited activity and a fear of tripping or falling, then call the number on your screen now. Learn if you're a candidate for our innovative treatment. Our staff will schedule you for a consultation free of charge. We will evaluate your condition and let you know whether or not you're a candidate for our non-surgical and narcotic-free therapies. As I said, your consultation is free of charge and could dramatically change your life. Thanks again for watching, and we look forward to seeing you soon at Sound Pain Solutions.